If you're over 60 and you've been embarrassed, confused, or quietly worried about sexual changes, especially masturbation, you are not alone. I'm Dr. Valentina, a urologist who spent decades helping men keep their bodies functioning safely and comfortably as they age. Today, I'm going to talk about something almost nobody will discuss on camera: how to masturbate safely after 60, and the exact doctor level warning signs that mean you should call your clinician instead of guessing.
This isn't porn, this isn't hype, this is healthcare. I'm going to give you practical, medically sound steps that protect your skin, your prostate, your heart, and your dignity. And I'll tell you three surprising things most doctors don't say in office visits that could prevent an emergency room trip. One of those surprises is a tiny overlooked detail about everyday medications that can make a normal session dangerous.
Why make a video about this? Because sexual health matters for quality of life at every age. Masturbation is one of the safest ways to stay sexually active, relieve tension, and learn what's normal for your body. But after 60, the body changes. Skin thins, circulation shifts, medication lists grow longer. Devices and techniques that were fine at 30 can cause infections, bleeding, or injury now. My goal is to give you a step by step safety checklist you can actually use and to tell you exactly when a symptom is safe to watch and when it's a medical red flag. Here's what I promise in this video.
A short, doctor approved safety checklist you can follow tonight.
Confirmed surprising medication interactions and medical conditions that change what's safe.
Clear, non judgmental advice for people with prostates, pacemakers, catheters, or fragile skin.
Exactly what to say to your doctor, so you won't be embarrassed and so they'll take you seriously. If this sounds useful, do two quick things for me. Hit like so YouTube knows to show this to more people who need it, and drop a comment saying, I care about senior sex health. I read every comment, and the community replies help others feel less alone. 1. The Safe Masturbation Checklist for Men Over 60. Before we talk about techniques or timing, let's get one thing straight. Safe masturbation isn't about performance, it's about preservation. You're preserving circulation, sensation, skin integrity, and confidence. When you treat your body with the same respect you'd give a fine instrument, it performs better, lasts longer, and gives you more pleasure with less risk. So let's go through this step by step checklist.
Step 1: Environment: warm, private, and pressure free.
The first rule of safe masturbation after 60 has nothing to do with the genitals. It's your environment. Warmth relaxes blood vessels and muscles, reducing the chance of cramping or pain. A cold room or rush situation triggers the sympathetic nervous system, the same system that constricts vessels, raises blood pressure, and makes erections harder to maintain. So before you start, set the stage. I warm the room, relax, and give yourself permission to slow down. Never feel rushed. Stress hormones are the biggest enemy of circulation. Avoid sitting on hard surfaces for long periods. This compresses nerves and can cause tingling or numbness later.
This simple setting adjustment lowers risk more than most people realize.
Step 2. Skin protection. Never go dry. After 60, the skin's collagen and oil glands thin out. That means friction that was fine decades ago can now tear the skin's microbarrier. Tiny tears invite bacteria, yeast, and inflammation, especially if you're diabetic or on blood thinners. Use a lubricant every single time. Prefer water based or silicone based lubricants labeled for sensitive skin. Avoid anything with glycerin, perfumes, or alcohol. These dry the tissue and feed yeast. If you have known sensitivity, medical grade sterile lubricants are ideal. A good rule: if it would sting on your lips, it will sting on your penis.
Never use body lotions or soaps. They alter the skin's pH and can cause chemical irritation. Step 3: Position, support, not strain.
This is one of the most overlooked causes of post masturbation pain in seniors. Many men unknowingly compress the pudendal nerve or prostate region by sitting with legs crossed or leaning forward too long.
Use a soft surface, support your lower back. Alternate positions if you feel tingling or numbness in your thighs, groin, or glutes. Those are signs of restricted blood flow.
And if you have any spinal, hip, or prostate conditions, avoid lying directly on your stomach. That position increases intrapelvic pressure, which can aggravate hemorrhoids or prostate inflammation. Step 4. Timing and tempo. Slower is healthier.
Older nerves fire more slowly. That's normal, but many men unconsciously chase sensation by using faster, tighter movements. This leads to microtrauma, bruising, or prolonged numbness called paresthesia.
So think slow and rhythmic, not forceful. Longer sessions with breaks actually increase nitric oxide release, improving blood flow to erectile tissue, like a mild workout for your arteries. If you find you're getting frustrated, focus on relaxation rather than goal oriented performance. Remember, masturbation is not a test, it's an exploration. Step 5. Hygiene before and after. Always wash your hands and genitals before and after. Use mild fragrance free soap. This prevents introducing bacteria, especially under the foreskin or around the urethral opening. If you use any device, sleeve, ring, or pump, clean it with warm water and antibacterial soap. Then let it air dry completely. Damp, enclosed devices grow bacteria and mold quickly. Step 6. The stop and check rule.
During or after masturbation, stop and check for
Persistent burning or stinging, blood in semen or urine, swelling that lasts longer than a few hours, bruising or sudden loss of sensation. If any of those occur, stop all activity and schedule an appointment. Don't self diagnose or hide it out of embarrassment. These are early signs of conditions like Peyronie's disease, microvascular injury, or medication side effects.
after 60, tissue recovery takes longer. Avoid back to back sessions within hours. Give your skin and muscles at least 24 hours to recover fully. Think of it as the same principle athletes follow. Rest builds resilience.
By following this simple checklist, you dramatically lower the risk of irritation, infection, and vascular strain, and you actually improve sensitivity over time. But here's the part most men never hear. Even if you follow every step correctly, changes in circulation and medications can silently alter what's safe. That's what we'll uncover next, and it's one of the most important hidden factors men over 60 need to understand.
2. The circulation trap. What changes after 60 and why it matters during masturbation.
One of the biggest myths I hear from older men is, Doctor, if I can still get an erection, my circulation must be fine. But that's not how it works. Blood flow to the penis isn't a yes or no switch, it's a finely tuned pressure system involving arteries, veins, and nerves. And after 60, the way your body manages that system changes drastically.
Let's break this down.
1. The aging artery effect. After 60, arteries become less elastic. The smooth muscle lining that helps them expand and contract, called the endothelium, becomes stiffer and produces less nitric oxide.
Nitric oxide is the key chemical that relaxes blood vessels during arousal. When it drops, erections can take longer, feel weaker, or fade faster. But here's the hidden danger.
Men often respond by increasing pressure manually, squeezing tighter, or using constrictive devices. That's like forcing more water through an old garden hose. You might get a brief surge, but the hose weakens. Repeated pressure on aging arteries or veins increases the risk of microtears, bruising, and even venous leak syndrome, a condition where blood flows into the penis but can't stay there.
So, rule number 1, don't use force to compensate for slower response. Instead, improve blood flow naturally through warmth, breathing, and patience.
2. The cold extremity warning sign. If your hands or feet are always cold, your pelvic blood flow might also be compromised. The same vascular stiffness that limits blood to your fingers also affects the arteries feeding your genitals.
Before stimulation, take 2 minutes to gently massage your thighs, lower abdomen, or inner groin. This primes blood vessels and improves responsiveness. Think of it as preheating your circulation.
And if you notice persistent coldness, tingling, or one sided numbness, that's not just aging, that's a vascular red flag worth checking with your doctor. 3. The venous trap. Here's something few people realize. Maintaining an erection depends as much on trapping blood as it does on getting it there. Veins in the penis have tiny valves that close off to keep blood inside. With age or conditions like diabetes, high blood pressure, or prolonged sitting, those valves weaken.
That's why many older men experience a pattern of good start, quick fade. Masturbation sessions become shorter, not because desire is gone, but because blood can't stay trapped.
Forcing it with constrictive rings or tight grips can make the problem worse. Over time, it trains the body to rely on pressure rather than circulation, reducing natural responsiveness. The fix? Strengthen circulation, not pressure. Short daily walks, pelvic floor exercises, kegels for men, and gentle stretches can improve venous function far more than any external gadget. 4. The oxygen deficit. Here's a scientific fact that surprises most patients.
When erections occur less frequently, penile tissue receives less oxygen. Over time, this can lead to atrophy. The tissue literally becomes less elastic and responsive.
That's why occasional sexual stimulation, even if it doesn't lead to climax, is actually therapeutic. It's like taking your joints through range of motion exercises. You're maintaining blood flow, preventing tissue stiffening, and supporting prostate drainage. So, yes, masturbation done safely can be part of preventive men's health after 60. 5. The heart connection. If you're experiencing neuroerectile difficulties or frequent loss of sensation, treat it as a heart health clue, not a bedroom problem. Studies show that erectile issues often appear 3 to 5 years before symptoms of cardiovascular disease. That's your body whispering that blood vessels elsewhere might also be narrowing.
So if your performance has changed, don't ignore it, leverage it, use it as motivation to check your heart, your cholesterol, and your blood sugar.
Sometimes the best bedroom fix starts with a cardiology referral.
6. The golden rule of circulation.
Your penis doesn't have its own blood supply, it borrows from the same system that feeds your brain and heart.
So anything that improves overall vascular health, hydration, walking, resistance training, nitric oxide rich foods like beets and leafy greens, and good sleep directly improves sexual safety and satisfaction. Forget expensive supplements. Circulation is lifestyle driven.
In short, the biggest trap after 60 isn't lack of desire, it's misunderstanding blood flow. The safest, most satisfying sexual experiences happen when circulation is supported, not forced. And that brings us to the next major factor: medications. Because even perfect circulation can be sabotaged by one of the most common mistakes men make, combining the wrong medications, supplements, or conditions during sexual activity. 3. The medication mistake: 3 common drugs that quietly change sexual safety.
If you're over 60, there's almost a 9 in 10 chance you're taking at least one prescription medication daily.
And here's what most men never realize: some of those pills change your body's entire response to arousal, circulation, and recovery, even when the label says nothing about sex.
This section might surprise you because these are everyday drugs, not rare prescriptions. But in urology, I see the same pattern over and over. A man follows all the safety steps, yet still ends up with irritation, bruising, or pain, all because of one of these medications quietly altering how his tissues and blood vessels behave.
Let's go through the 3 biggest culprits. 1. Blood thinners, the hidden bruising risk. Medications like aspirin, warfarin, Coumadin, clopidogrel, Plavix, and even newer agents like apixaban, Eliquis, or rivaroxaban, Xarelto make your blood less likely to clot. That's good for preventing stroke, but it also means any small frictional injury can bruise or bleed far more than expected. In men over 60, where skin capillaries are already fragile, this can cause small purple patches on the shaft or scrotum, persistent redness or soreness after masturbation, delayed healing or oozing from tiny cuts. The danger is not usually catastrophic bleeding, it's infection risk and tissue trauma that goes unnoticed. If you're on any blood thinner, use extra lubrication, avoid tight devices or rings, and if you notice unexplained discoloration, stop all activity until it resolves. And please, never feel embarrassed to show a bruise to your urologist. We'd rather see it early than treat a cellulitis infection later. 2. Alpha blockers and prostate medications, the circulation confuser.
Drugs like tamsulosin, Flomax, or alfuzosin are common for enlarged prostate. They relax smooth muscles in the bladder neck, but they also lower blood pressure and alter nerve signaling to pelvic tissues.
What does that mean? It's easier to get dizzy or lightheaded during or after a climax.
Erections may feel weaker or shorter in duration.
Some men experience retrograde ejaculation, where semen flows backward into the bladder instead of out. That's not dangerous, but it can be disorienting if you're not expecting it. The first time it happens, many men think something's wrong. It's simply a side effect of reduced muscular contraction.
So, if your prostate meds cause sudden fatigue or dizziness after masturbation, pause and rest. Don't strain or push through it. It's your blood pressure temporarily dropping.
If you take hard medication, make sure your doctor knows exactly what supplements or ED pills you're using, even the herbal ones labeled natural male enhancer. Some of those contain unlisted Simdetail analogs that can dangerously amplify the effect. Medications don't just control disease, they alter how your entire vascular and nervous system respond to touch.
So, before trying new techniques or blaming yourself for changes in performance, review your medication list with your doctor. Ask him,
Could any of these affect my circulation, skin, or sexual response? It's one of the simplest ways to prevent injuries and protect long term function. The goal isn't to stop masturbation, it's to make it safe for your body as it is now, not how it was decades ago. In the next section, we'll talk about something most men never discuss: why pleasure itself changes with age. Nerve sensitivity, skin texture, and hormonal shifts all play a role, and understanding them can make the difference between frustration and fulfillment.
4. Nerve sensitivity and skin changes. Why pleasure feels different after 60, and how to get it back safely.
Many men over 60 quietly wonder, why doesn't it feel the same anymore? It's one of the most common concerns I hear in my office. And here's the truth: it's not in your head. It's in your nerves, skin, and hormones, all of which naturally evolve with age. Understanding these changes doesn't just protect you from injury, it can actually bring pleasure back by aligning your expectations with physiology. Let's break it down. 1. The nerve decline. Nobody talks about.
Starting around age 55, the body slowly loses peripheral nerve endings, the sensory fibers that detect touch, temperature, and vibration. In the genital area, this means
You may need longer or stronger stimulation to reach climax. Light touch feels duller. Recovery after climax. The refractory period takes longer.
this isn't nerve damage, it's simply age related remodeling.
Think of it like the volume dial on a stereo. The system still works, but you have to turn it higher to hear the same song. However, turning it too high through excessive pressure or rough handling creates micro injury. That's why many older men experience post activity soreness or numbness. Using slower, broader strokes and alternating grip pressure helps stimulate deeper nerve receptors while avoiding surface trauma. 2. Skin. Thinner, drier, and more vulnerable. Male genital skin becomes thinner and drier with age due to reduced collagen, lower androgen levels, and slower oil gland function. That's why friction, even mild, can cause irritation, especially around the frenulum, the underside of the head, or scrotal folds. Here's a doctor approved strategy: always use lubrication. As we said earlier,
Add gentle aftercare, rinse with warm water, and apply a tiny amount of pure aloe vera or medical grade barrier cream afterward.
this helps repair the skin barrier, similar to moisturizing after shaving. It's not about vanity, it's about preserving sensitivity and preventing micro tears that can increase infection risk. 3. Hormonal shifts, the testosterone connection. By 60, testosterone levels are typically 30 to 50% lower than they were in youth. This affects both libido and nerve sensitivity. Testosterone supports nerve growth and dopamine signaling in the pleasure centers of the brain. The good news: even modest increases through lifestyle can make a real difference.
Strength training, especially leg and core work.
Deep sleep, healthy fats, avocado, olive oil, eggs, managing stress and blood sugar. These raise natural testosterone and can enhance both energy and sexual sensation without medication.
If you've noticed significant loss of desire, morning erections, or muscle tone, it's worth getting a blood test for total and free testosterone. Sometimes restoring balance under medical supervision renews both pleasure and performance.
Early warning signs of nerve trouble. Sometimes dullness or tingling isn't just aging, it's a sign of underlying disease.
If you experience burning or numbness in the feet or groin,
Sharp, electric sensation.
gradual loss of sensation spreading outward,
That could be peripheral neuropathy, often linked to diabetes, B12 deficiency, or spinal issues. The earlier it's evaluated, the more likely it can be slowed or reversed. 6. The mind body reset. Finally, remember this: the brain is your largest sex organ. Stress, depression, or chronic anxiety block dopamine and serotonin, the same chemicals that heighten pleasure. So even if your body works, your brain might be in standby mode. Mindful breathing, exercise, or relaxation before stimulation can double sensitivity.
your nervous system relaxes, blood flow improves, and you reconnect with physical signals more clearly. The takeaway: pleasure changes, but it doesn't disappear.
When you understand how nerves and skin evolve, you stop forcing what no longer works and start cultivating what your body still offers. Pleasure becomes less about intensity and more about awareness. And ironically, that's when most men regain both comfort and climax quality. In the next section, we'll dive into something men rarely connect to masturbation but absolutely should: the prostate. Its health determines not only pleasure but bladder control, recovery time, and even infection risk.
Fifth, the prostate factor: how prostate health affects pleasure, urination, and recovery.
Most men think of the prostate only when something goes wrong, when urination slows, pressure builds, or discomfort sets in. But the prostate isn't just a plumbing valve, it's a vascular, muscular, and sensory organ deeply tied to pelvic comfort and sexual satisfaction. Understanding how it changes after 60 can protect your bladder, your energy, and even your confidence. 1. The traffic jam problem. Picture your prostate as a round valve wrapped around the urethra, the tube that carries urine and semen. When you're young, it's flexible and opens easily, but with age and hormonal shifts, prostate tissue often enlarges. It's called benign prostatic hyperplasia, BPH, and it's incredibly common. By 60, about half of men have some degree of it. That enlargement gently squeezes the urethra, creating a traffic jam for both urine and seminal fluid. The result? Weak or slow urinary stream, dribbling after urination, the need to urinate multiple times at night.
Longer recovery after climax. The key isn't panic, it's awareness. Early management keeps that tissue supple and prevents secondary problems like bladder strain or infection.
2. The circulation connection. The prostate has one of the richest blood supplies in the male body, but those same vessels are highly sensitive to inflammation and congestion. When circulation slows from sitting too long, dehydration, or vascular stiffness, the gland can become stagnant.
You might feel a dull ache between the scrotum and anus, the perineum, or a sense of fullness in the pelvis.
Simple habits improve this dramatically. Stand and walk every hour. Drink water throughout the day. Add circulation foods like beets, pomegranate, and garlic. Limit long periods of sitting on hard chairs. These habits improve oxygen flow and help the prostate drain naturally. 3. The inflammation factor. Chronic low-grade inflammation called prostatitis is another silent issue in older men. It isn't always caused by infection. Often it's due to mechanical pressure, poor posture, or systemic inflammation from diet and stress. Pelvic tightness,
Burning after urination, discomfort when sitting for long periods.
gentle pelvic floor stretches, deep breathing, and anti-inflammatory diets rich in omega-3 fats. Salmon, walnuts, flaxseed can reduce flare-ups naturally. And if pain or fever develops, a medical check is essential. Early antibiotic or anti inflammatory treatment prevents chronic pain later. 4. Hormones and the prostate. The prostate depends on balanced testosterone and estrogen. After 60, testosterone declines while an enzyme called aromatase can convert more of it into estrogen. That imbalance fuels prostate growth and water retention in the tissue. Lifestyle steps that support hormonal balance. Maintain healthy body weight. Include resistance training. Limit alcohol and sugar, both raise aromatase activity. Ensure adequate zinc and vitamin D.
These help stabilize prostate volume and reduce nocturnal urination.
5. The pelvic floor link.
Your prostate sits on the pelvic floor, a hammock of muscles that controls both bladder and sexual function.
If these muscles become too tight or too weak, they can irritate the prostate and disrupt blood flow. Exercises like gentle kegels for men or diaphragmatic breathing keep those muscles balanced, not clenched. Think of it as yoga for your pelvis, strength with flexibility. 6. When the prostate sends a signal, the body often whispers before it screams. If you notice, pain radiating to the lower back or groin, blood in urine or semen, difficulty starting or stopping urination, nighttime urgency, worsening, those are not normal aging. They're early clues to get checked. Modern urology offers quick, non invasive imaging and medications that can shrink the prostate and relieve symptoms safely. One of the most important lessons I can share is this: masturbation is safe until it isn't. And the difference is rarely a dramatic injury. It's subtle signs your body is sending. If you recognize them early, you prevent complications. If you ignore them, even minor issues can escalate quickly. Here are the 5 red flags every man over 60 should know. When persistent pain or burning, pain during or after masturbation that lasts longer than a day is a normal aging. This can indicate urinary tract infection, prostatitis, micro tears in sensitive tissue, even mild burnings worth a call to your doctor. Early treatment prevents chronic pain and infections. 2. Blood in urine or semen. Any trace of blood, pink, red, or brown, requires medical evaluation. Possible causes include prostate irritation or infection, urinary tract stones, rarely malignancies. Don't wait for it to disappear. Document the time and amount and whether it occurs with activity or at rest. Bring that information to your urologist. It makes diagnosis faster and safer. 3. Numbness or tingling in genitals or perineum. Dullness, tingling, or loss of sensation can signal nerve compression or peripheral neuropathy. Potential causes: diabetes, spinal stenosis, circulatory issue. Early intervention, including nerve testing, lifestyle adjustments, and physical therapy, can restore sensation and prevent permanent changes. 4. Significant changes in urination. Watch for difficulty starting or stopping, weak stream, frequent nighttime urination. While mild changes can be normal, sudden or worsening issues may indicate BPH, infection, or bladder dysfunction. Early evaluation protects kidney function and prevents long-term complications.
5. Dizziness, fainting, or chest pain during or after activity.
This is a serious emergency. Even mild exertion or arousal can stress the heart, especially in men with hypertension, heart disease, or those on nitrates. Symptoms like chest pressure or tightness, lightheadedness or fainting, rapid or irregular heartbeat require immediate medical attention. Never ignore cardiovascular warning signs. Early intervention saves lives. If you found this video useful, hit like. It helps other men over 60 discover life-changing, doctor-approved advice. Comment below with your thoughts, questions, or experiences. I read every comment and respond personally when possible. Even sharing one tip could help a friend or family member protect their health. And don't forget to subscribe for more senior men's health guidance that's evidence-based, practical, and never judgmental. Take what you've learned today, respect your body, and make these habits part of your routine. Your health, pleasure, and confidence will thank you.